urothelial carcinoma, unlike a lot of other cancers, has a particular predilection for variant histologies or differentiations. And of these, the most common one is urothelial carcinoma with squamous differentiation. We know historically that these patients tend to have worse outcome, more advanced disease at the time of diagnosis, poor prognosis relative to patients with pure urothelial carcinoma. And there is some evidence that, in particular with perioperative chemotherapy for patients that are going to go on to cystectomy, that patients with squamous histology tend to do worse and not benefit from chemotherapy. So with that background, we were interested in looking at how these patients fared in the era of some of the newer systemic therapies that we have for bladder cancer. So specifically, we focus on immune checkpoint inhibitors and the antibody drug conjugate enfortumab vedotin. One of the things that I would also highlight is that a lot of the large therapeutic trials that we use to guide our management for patients with urothelial carcinomas exclude patients who have predominant variant histology. They'll include some patients if there's a component of variant histology that's present on their biopsy, if it's usually less than 50%. But even in those cases, outcomes generally are not reported or stratified by the presence of variant histology. So there's really a paucity of data, prospective data on how to best treat these patients. And so it's definitely an open question with these new therapies, whether these patients would fare as well, would have the same benefit, or if we would see, similar to the observations that we had seen in the era of platinum-based chemotherapy, that squamous histology was associated with increased resistance to immune checkpoint inhibitors or enfortumab vedotin. So that was also a big part of the motivation for using this retrospective analysis to try to look at outcomes at a more granular level. So this was a single institution retrospective study. So we looked at patients from 2014 to 2022 that had metastatic urothelial carcinoma and that were treated with either a checkpoint inhibitor or enfortumab vedotin. And as I was saying, we focused on patients who either had pure urothelial carcinoma in their biopsies versus patients who had some component of squamous histology present on their biopsies. And this was not, there was not a central pathologic review, but these were all cases where pathology was reviewed by trained, dedicated genitourinary pathologists here at UCSF. So we looked at patients who had any presence of squamous histology on their biopsy, no other variant histology is present. And we further stratified them by patients who had just a component of focal squamous histology present, versus patients who had predominant squamous histology and patients who had pure squamous histology present. So then with that patient population, our primary objective was to compare outcomes to either immune checkpoint inhibitors or enfortumab vedotin. So we looked at objective response rate, progression-free survival, and overall survival. But embedded into that, a related question that we had was whether there would be any genomic differences between the two, between pure urothelial carcinoma patients in cases with any degree of squamous histology present. So we also compared using CLIA-certified assays the genomic profile of these tumors. And the hope was that it might shed some light on the biological underpinning of any differences in outcome that we would observe between the two patient groups.